Many of the children that are transferred here are considered cases that will not survive if they stay in their location, whether it's in the United States or whether it's outside the United States. Other hospitals, other children's hospitals will send us cases. We do not send cases out. The buck stops here.
We have the expertise and the technology to be able to serve these children's needs whenever they need us. We've enabled access to information that's capable of being transmitted to any provider anywhere, so you can coordinate the care. A lot more of the electronic medical record today is about devices, physiologic monitors, x-rays, CAT scans, MRIs. So what we have done here at Miami Children's is able to integrate any data that's needed for patient care.
In the past, there were paper charts. When you came to see a patient, you had to look for the chart. Sometimes the nurse had the chart, sometimes the medical student had the chart, sometimes the resident had the chart. Citrix has done a complete shift for us. And it's been one of the greatest things we did at this hospital, because now we have electronic medical record. Now the doctor comes in, logs on a computer, and the need for the chart has been eliminated. On the front end, we have Zen Mobile, Citrix receiver, and GoToMeeting with HD Faces. In the middle, we have Zen App and Zen Desktop. And on the back end, Zen Server and NetScaler. Physicians are demanding mobility. Most of these physicians use their iPads, a lot use their laptops. Some of them were logging in from the desktop from home, and regardless of what system they used, they had consistent performance and were always able to retrieve the data they needed. This is something that never existed at Miami Children's.
If you think about our core mission, it's to be able to be where the child is. That means bring the care when it's needed and where it's needed. We serve that need for South Florida, the Caribbean, and Latin America. But there's not enough of these providers being trained, so you need to deploy technology.
Dr. Rosie, I see you are there with Alexandra. I had an opportunity to review her records.
The telemedicine has now erased the need for the patient to come to the hospital. A hospital can now come to the patient.
Alexandra had a chest x-ray done this morning. Can you please bring it up so we can review it together?
Through Citrix, when they access their medical record, they can be anywhere, erasing geography and making the hospital come to the patient.
That's our ultimate goal, is to provide care wherever that child is. And we have set up a very powerful set of portals. This means the doctor, the patient and family, and payors are capable of accessing that data anytime, anywhere. I truly believe that this is necessary for our survival. I'm not sure a lot of the present care health model would survive in its present form. If you do not adapt and innovate, I don't think we will be around. So this is born of necessity.